3:57. Have you let people in, Caroline?
Yep,
Oh,
webinar is open.
great. All right. Well, thank you all for joining us. We're going to give us just a moment as people start to come on to the webinar so we don't get ahead of ourselves. There's a lot of people signed up and a lot to talk about today. So we're really looking forward to the next hour with you all. It's always interesting to watch the ticker go up. So we'll wait till we have a critical mass on board and we'll get going. I'm starting to see the numbers slow down a little, so we're going to get started. Thank you all for joining us today. Welcome to 2022. And we realized as we were planning this webinar that it is actually our 22nd webinar, which was a nice coincidence and an interesting way to start the year. I am Carrie Shum from Hadaway Communications, and we are the secretariat for this community of practice to help people really understand how best to talk to people about all this overwhelming and confusing information around COVID-19 and what we should all be doing. So much has changed since we met a month ago, and we designed this panel to address the really pressing issue that is before us right now, which is safely keeping schools open. Our goal today is to give you all the hows, really practical, immediate advice that you can put to work right away, because we know you are facing decisions every day about what to do with all the children in your school systems and how to talk to people about the decisions that you've made. I'm going to start by introducing our panelists. We have four really, really fantastic people here to talk with you today, who offer a lot of different perspectives on this topic from all their experiences over the last few months. And then I'm going to kick us off by going through some data from our stat tracking surveys. We've been asking the general public as well as parents about some of the things that are going on in schools. I wanted to do that as a level set to say, here's what we know about kind of people's attitudes and behaviors. One caveat is that it's from October, but we are putting this survey out into the field next week. So in particular, if there are burning questions that you would love us to answer with our next wave, please put that in the chat or raise your hand to talk about those, because we'd really love your input there. And then we'll turn to more general discussion with our four panelists. As always, I just want to remind you all, please ask questions along the way. You can put them in the chat, you can put them in the Q&A. We'll stop for things that are kind of breaking news as we're talking. We'll stop and address them there. And then we do build in plenty of time at the end to really have a robust discussion with you all. So joining me today, first we have Nick Simmons, who is with the Department of Education. He's the Senior Advisor for School Reopening and Recovery. And he's been talking to school officials all across the country about their needs and concerns, and will offer his insights based on that broad perspective from what he's seeing from all the people that he's been talking to. Then we also have joining us Leah Perkinson, who for the last 18 months has been the manager of pandemics at the Rockefeller Foundation and has led their efforts to support COVID testing in K through 12 schools. In particular, she has led the K through 12 Learning Network, which has been a really intensive series of trainings and convenings for school administrators and school leaders over the last few months to really wrestle with all the things that they're facing every day. We also have Dr. Eva Stone, who's the manager of district health for Jefferson County in Kentucky. And when we were prepping for this webinar the other day, she said, I am all testing all the time. So she's going to share with us everything that she's seeing on the ground in Kentucky. And then we also have Deanna Bruce, who is a school health leader who for the past 18 months has helped the District of Columbia in Washington, D.C. with implementing all of their COVID policies and mitigation strategies. So we've got the broad perspective from lots of people, really drilling down to people who are wrestling with what to do with kids and in schools every day. So it should be a great session. So I'm going to get started, as I said, talking about the data and what we know about attitudes and behaviors around schools and the things that we're asking people to do. Can you go to the next slide? If any of you are on social media, you have probably seen either this tweet or some variation of this, which for all of us communicators is somewhat frustrating and yet really is representative of what a lot of people are feeling right now, which is that the advice they're getting is both either overwhelming, confusing, conflicting, or impossible to act upon. And so, as I said at the beginning of this, we want to give you information that's helpful, unconfusing, and ideally something that you can take into your daily lives tomorrow and really do something with. So we're starting with some data to really ground us on what's going on. This is a question we asked, again, this was asked the week after the White House issued their school policies in mid-September. So right as school was starting, right as the big federal response was underway. And we asked parents a very simple question: which steps has your child's school implemented this year? The most interesting thing about the response is right in the middle. Most people have, a quarter of people don't know. So these are people with children in school who did not have any idea of what their school was doing. And then when somebody did know something, the most common ones are those fairly simple and straightforward ones of mask wearing and hand hygiene, some social distancing, a little bit less. But then when it got to the more involved or complicated things like wastewater testing or improved ventilation, far fewer parents, their schools, their children were attending, were doing that. And then when you look at testing, it's really, they were more likely to be testing teachers and staff, less likely to be testing students. And those numbers were, around 20% or less. You can go to the next slide. Then we've also been tracking attitudes about vaccination. So again, this is from September, before vaccines were approved for the youngest cohort of children. But what we saw over that time was, as it got closer to reality, people were less likely to say that they were going to vaccinate their child. Certainly softening at the very end, somewhat likely, and then more people saying not likely at all. And if you saw the numbers that came out today, which I got an AP alert on my phone around noon, that the numbers themselves are far less even than these. So when you're looking at all the things that we thought would keep our kids safe, vaccines, which they're not being used in the way that would really make that happen. Then we asked about general attitudes. The one thing important here, and we do see this across all of our data, is behaviors travel together. So vaccinated parents are more likely to say that they would have their child vaccinated. People who believe that it's important to get vaccinated are more likely to have their child vaccinated. And the flip side is also true. So if a parent isn't vaccinated, they are highly unlikely to have their child vaccinated. And if they don't believe vaccination is important to ending the pandemic. So we've seen that all along the way. Sometimes we go very deep in it. I just wanted to make that point that if you see one thing, you're probably likely to see another when you're looking at parents and students. And then we looked particularly for this meeting at testing. And again, that same behavior. If parents are likely to get tested themselves or believe it's important to end the pandemic, they're also likely to have their child vaccinated. And then we asked just general safety. So we asked, how safe do you think schools are? And only about a third think they are. More than that think that schools are not safe for kids. And this was right at the beginning of the school year, before where people were more perhaps in fear of outbreaks than now when most kids have not seen them. But then we asked it another way, which was compared to last year. And despite all of the increases and things we know and ways to increase vaccinations, certainly among teachers and staff, it didn't go up that much. And it was certainly less than half of people saying that schools are safer this year than they were the year before. Interestingly, though, testing intent has been really steady. So we started asking this question over a year ago, and we've seen very little change in that most parents are supportive of having their child tested for COVID in school. It was up a little higher a year ago with I don't know what number surge it was, but we were seeing a surge around the holidays last year. It's trickled down a little, but not the way we've seen some of our other attitudes change. And when we did the first wave before we did the first wave of this, we also did focus groups with parents to get a handle on what we were seeing. And parents get it. They really understand the value of rapid testing, why it would be for asymptomatic kids. Their initial response, and remember, this was right in the fall where it was facing perhaps the first full year of remote school. They're desperate to get their kids back in school. They did have a lot of logistical questions, which is what you're going to hear a lot about from Eva and Deanna about how they've helped schools overcome them, because those are real and those are an impediment to people feeling comfortable with this. And interestingly, but not surprisingly, if you are a parent of kids, parents are much more supportive of testing for older children, which makes sense. You know, the idea of your kindergartner or your second grader being faced with a medical professional doing something, you know, putting a swab up their nose a couple times a week is a little more overwhelming if you've got younger kids. So you see again that it makes sense, but it's interesting to track in and see what happens with this. And then we asked about mandates. And there is a lot of support for mask mandates in schools. Again, we've got 2/3 of people, this is general public, asking about that, saying that schools should be able to mandate that everyone wear masks. When you add in the neithers or the neutrals, you're up to 3/4 of people saying it's okay for schools to say that everyone needs to wear a mask. And the interesting thing there is when we asked about a different type of mandate, which is about a different topic of vaccination, and for those more casual daily things that we are looking at in our lives, the numbers are lower. So this is a popular thing. So contrary to what you might be seeing in the media, there is not a great deal of controversy about whether people should be able to wear masks in schools. There's a small and probably extremely vocal group of people who are against this, but most people are fine with it. And we've also tested messaging on mandates, and we wanted to resurface this for you because of the big idea behind it, which the way mandates are being framed often is about freedom of choice. People should be, you know, it's not that we want to tell people not to do it, but we shouldn't make them do it. When you frame it around ensuring everyone doing their part, that's where people really get behind this idea. It makes intuitive sense that it's not a thing to control people, but it's a nudge that makes sure, you know, all of us have given up a lot and have done a lot during the pandemic to try to keep ourselves and those we love safe. This is just that little reminder to say, it's just a way to help everybody do that. And it does work well. So we wanted to put that again in our mantra of useful things that you could put into action right away. This is a way to talk about if you're looking at how to talk about a mandate in your district or with your teachers and parents. It's a way that can make it really effective and have it make sense to them. So this is the end of the presentation and data portion. I'm going to turn it over to Nick to talk about everything that he can share with us about his experience with the Department of Education.
Sure. Thank you, Carrie, for the presentation and for having me today. It's good to be here with everybody. So I don't want to take up too much time. I think I would just share a few points that hopefully build on that data and maybe just a broad strokes perspective of what we're seeing here at the department. So I think first and foremost, I would say this is the third school year that our schools have been dealing with COVID-19 and all those disruptions. And I would say we have a lot of data on spread of COVID in schools, on what mitigation strategies work. And it's been very clear almost since the end of the first school year that with the right mitigation strategies in place, schools is safe. Students can learn safely inside the classroom, even when case rates are extremely high in a community. We have data that shows that often schools can be actually the safest place in an entire community because teachers do such an excellent job of enforcing the rules. And often we find that most COVID cases among children actually come outside of the classroom. So it's at that, maybe that's that pickup basketball game or at a sleepover or, hanging out sort of different places outside of school. And we have some data that I can put in the chat that shows that. And so we've known, for about 2 to 3 years now, 2 to 3 school years now, that we can learn safely in school. And I think that data should be shared and shared widely, which I will drop in the chat. And I would also say it's very encouraging right now that actually 95% of all students are learning in person back in school today. And I know there's been a ton of headlines that have shown really harping on the areas in the school districts that have had to make a switch. But there's a lot of headlines on that and less so on the 95% that have gone back. And so I think parents, communities, districts they've gone through this. They sort of know how to do it safely, and they are bringing students back. So I think that's sort of the first point. One last point on that is that all that data was with Delta. And so we know that Omicron is more mild, is absolutely leading to far, far, far less hospitalizations. It does spread quicker, which makes the challenge, still makes it challenging inside the building. But we have no reason to believe that the data of school being okay for in-person learning, there's nothing to suggest so far that any of that has changed in the face of Omicron. The second point I would make is vaccinations. So Carrie mentioned some of the data on it. I think one really important point that we see resonate a lot with parents and schools that we speak to is in the new guidance. There's obviously a lot of confusion and also anxiety about, do I quarantine? How long do I quarantine? I don't want to have to stay at home for 5 days, for 10 days, et cetera. For students and staff that are vaccinated, if you come into close contact at all with somebody who tests positive, you don't need to do anything. You should monitor for symptoms and wear a mask outside of school, but that's it. It's as simple as that. You don't need to quarantine. You don't need to worry, was I in 2 feet or 3 feet? You're done. And so I think it's a big incentive, and we see it resonate with parents and students. Don't risk missing class. Don't risk having to miss that sports game or that performance. So getting vaccinated isn't just about your own health, but your ability to stay in school. And then finally, the last point I would make is on testing. Obviously, that is the biggest need and sort of issue right now that we're seeing play out across the country. I'm sure we'll talk a lot about that today, but I just wanted to flag an announcement that came out this morning from the Biden-Harris administration, where the White House will, with the CDC and HHS and us at ED, are working to send 10 million more tests each month for free into schools. And we will also be creating a few more resources to help. We'll be sending in FEMA coordinated testing centers to support schools and providing a bunch more resources. And so happy to talk more about that as we progress.
Thank you, Nick. That's really, really helpful. And I think that key point that we were talking about as we were prepping of schools, the rate in schools is lower often than the surrounding community is a really important one to keep in mind. And I'm going to turn over to Leah next to talk about all the work she's been doing and everything she knows about all the 5 pilot cities and everything that she's been doing in her learning network.
Thanks, Carrie, and thanks, Nick. So good to hear about the update from the administration about the 10 million tests. I mean, it's incredible. So thanks for having me here today. What I wanted to talk about is some of the challenges that have been consistently brought up over the communities of practice that I've either facilitated or hosted for the past 18 months related to testing in K through 12. And these are from our K through 12 school and district leaders. So I want to share the challenge, but obviously I also want to share how they solved for it. So the first challenge here is really, it's a mindset. It's the mindset that we've got to go all in or not go in at all. We want to do all the testing, we want to do all the contact tracing and all the reporting, and we want to do it right because the stakes are really high. And this is a really high bar for a school or district who hasn't yet started to test to meet. What we've heard that's been so helpful is pilots. So really starting small to go big. Jefferson County Public Schools, Dr. Eva Stone, who's with us today, 96,000 students in that district. About 8 months ago, they were doing a handful of tests every week. And now it's thousands and thousands and thousands. So they started small, they figured out what worked, and they scaled it up. Suzanne Wright, who works with Dr. Eva Stone to do all this, she described it as a Navy SEAL operation because it is so involved, but that's not where they started. Okay, I mean, they probably start, you could say like a baby seal operation. I think that's a more manageable first step. Um, so what we've heard is that it's important to communicate that there is an option between doing nothing in terms of testing and doing everything. So that in between can look something like a pilot so that you feel like you're not jumping into the deep end. Another challenge that's related is feeling like you don't have the individualized support to stand up a testing program in your school or your district. Most definitely a year ago, that was really across the board. We've made a tremendous amount of progress. This is this is a resource you may have already heard about, but I think we really need to put it in the chat because I not everybody knows about it. It's called Operation Expanded Testing. If you're looking for that individualized support, if you're looking to call somebody who can walk you through what testing will look like in your school, we'll send you the supplies for free and help you stand it up. I think Caroline put in the chat the link to the different contact info for the providers. There are 3 main providers across the United States. You get in touch with them, they can help you at no cost stand up testing. This was put in place by HHS and CDC. So this is available for folks that may not have a free testing option in their state, or for whatever reason that testing option isn't working for them. The other support that's seemed to really help schools and districts is a community of practice. And I'm not just saying that because I've been involved in them. This is what I'm hearing from others who have participated. Having this space where folks who are doing the same thing, they can share in this collective experience and speak candidly about the challenges that they're running up against. It is really important. You know, in some cases, there could just be one district in a large geographic area that's doing testing, so they're feeling like they're an island. So having the chance to connect with peers across the country in some cases and cross-pollinate is helpful. I mean, there's also options for local community of practice. So I know Deanna Bruce, who's with us today, hosts and facilitates one of those. There's also a statewide community of practice that Washington State hosts, and I think we can put that link in the chat so you get kind of an idea of what this could look like. And then we also hosted a national community of practice in November and December that was co-hosted with the CDC and the US Department of Education. And what we were able to draw out of that is a number of key takeaways and a number, like a catalog of short video clips where school and district leaders are talking about the best practices that they have in terms of procurement, test to stay, solving for staffing issues. So we encourage you to go and check out that website. Let's see here. I think if you're thinking about standing up a community of practice, 2 important things. One, it's always been so helpful to have technical experts who can weigh in when questions come up. So maybe that's from your local health department or a local university. And also important to have a built-in feedback loop. So for example, I mean, this is just an example. In the National Learning Network that we had the CDC and US Department of Ed, and that was super important because those are the folks that influence the policy that influence the day-to-day operations. So whether, you know, that is the PTA or the school board or some other stakeholder group that can attend those sessions, maybe not the whole entire session, but for some of it, that might be a real value add in terms of everybody being on the same page in terms of what the issues are. So I have much more to share, but I want to stop there. Actually, let me just say that in terms of the individualized support, CDC is releasing some test to stay guidance that it's like a checklist and also a FAQ. So that's coming out soon. So hopefully that can help folks actually think about implementing test to stay. And then Duke Margolis with Rockefeller is releasing a test to stay report Wednesday of next week. So this is based on interviews with Illinois, Massachusetts, and North Carolina, who all run test to stay programs, talks about the challenges and how to ensure equity if you're doing test to stay. So let me stop there, but thanks for the time to talk.
Yeah, thank you, Leah. And again, thank you for reinforcing our theme today, which is practical tools that people can turn to right away. I mean, this idea that there's all this stuff out there that anyone who's looking for guidance, for help, for supplies, for medical, for support in all kinds of ways. So thank you for Caroline's keeping us up to date, dropping those all in the chat. And again, when we send out the wrap up from this, we'll include all of that information to everyone as well. So thank you. But yeah, let's turn to our experts on the ground. So Dr. Stone, let's have you tell us what's going on in Kentucky and what you've learned from your, I love that, from baby SEAL to Navy SEAL.
Yes, I'm laughing. So first, let me reiterate what Leah said about that support, because don't underestimate having that support. I've actually developed some very close friends now who I can call and say, oh my goodness, what should we do next? And people who can connect you to other people when you have things that come up and questions that come up, because that's going to happen. Everybody's community looks a little different. The dynamics around COVID in the communities are different. And so it just, it helps to have that group of people, those contacts you can reach out to just get some support. So I'm in Louisville, Kentucky, and we are fortunate to have had a grant through the Rock Foundation we were one of the pilot cities for testing protocol. So that's how we went from baby SEAL to Navy SEAL. And it was slow going to get us started, but there weren't many resources at that time. And so everybody was just trying to figure it out. Dynamic wise, we didn't return to in-person learning until last March, really, is when we brought students back, and it was in a hybrid model. So it was last year about this time that we were really working to get testing off the ground. So we started small with some learning hubs that were open in the city. And we started with learning hubs. Leah mentioned Suzanne Wright. It was Suzanne's idea, because she said these are the trusted places in the community where parents take their children. They trust the people who are there. And so that's probably the best place we need to start. And so we worked with our community partners with those hubs to make testing available. And that's really where we started. At that time, we had a statewide mask mandate because the governor had issued a requirement for masking. And since that time, that legislatively, that authority for him to do that was taken away. But in my district, our superintendent and school board have been very proactive. So we're able to have that mandate for masks indoors. And I would tell anybody who's trying to consider mitigation strategies and how to increase confidence in these measures, masking is significantly important. And masking was incredibly helpful for us to get through the Delta variant very well. And in a district with 96,000 students and 16,000 employees, that is what kept me awake at night, the anxiety of people getting sick and having responsibility for the health and well-being of people. And masking made these mitigation strategies together, that Swiss cheese model that everybody talks about, it works, it's significant. It will help keep schools. Our mantra has been students in, COVID out. And that's been what we have aimed to do and our goals. So we started small with the testing, with the learning hubs. Then we transitioned to our summer programs. There were hundreds sites set up across the city for summer school programs, which was again overwhelming, because just as that started is when Delta came along. And so there for a brief time, the mask mandate was gone. And we definitely saw the impact of that in the learning hubs. And so when the school started in the fall, we had a plan in place for testing across all of our schools based on the learnings from the hubs. And the testing that we did at those small learning hubs was very significant, because it helped us keep Delta under control in those small sites. So we have had an incredible relationship with our health department, which has been, we meet every week still. We meet about testing and we meet about contact tracing. And so that relationship has been very important in helping us kind of tag team and work together and combine our efforts rather than trying to duplicate our efforts. But it was very evident that there were things that we were going to have to take on within the school to be able to respond and to move quickly. So we started testing when all of our students came back to school on August the 11th. We started testing on August the 12th. And the first testing that we did was with parental consent. We had a team that would go out to the schools. We offer testing at every school across the district. And so every school has testing each week. And now it's actually every facility within the district. So we started first with just those parental consents and staff who wanted tested. We worked to increase consent. We worked a lot with the news media. Our communications folks sent messages out to parents. Schools stood in car lines and sent out text messages and emails to their families, encouraging them to sign up and to enroll and to consider the testing. Our students were the best champions because, you know, they would tell each other, it's just sticking a Q-tip in your nose. It's no big deal. The media interviewed some of the kids and did videos, and that was very helpful. Once people figured out it wasn't the back to the brain test, which is the language that they use, they would see other people getting tested at school or going to get tested. That word of mouth really helped. Then our school board we rolled into a test to stay and test to play models as well. And so the biggest thing that weekly screening testing that we do that increased participation was that anybody who was participating in extracurricular activities needed to participate in test to play. That helped us monitor positivity, quite frankly, because obviously the more testing that we're doing, the more that we can have a real sense of what's going on in the buildings. We also open drive-through testing sites. We have 50 testing sites across the city that are open in the afternoons, where parents and caregivers, family members of students, staff can also go for testing. And our families, initially, those weren't as well utilized. We started with 24 testing sites, have ended up growing that to 50 testing sites, along with a mobile testing unit that goes to our areas that don't have, where we have families without transportation as well. And then we also offer symptomatic testing. Our school nurses, we put a nurse in every school with the pandemic, for the pandemic, and they can do testing for symptomatic students or staff, and they also can do testing for those who are vaccinated that are exposed that need that testing at day 5, 6, or 7. So we're doing between 20 and 25,000 tests per week. And it really helps with a sense of what's going on in the school. So again, Leah said, you know, get your partners, because we certainly didn't do that alone. It's a lot of work to have lifted that up, but with the supports, without question, the masking, the testing, and vaccines, because we've also offered on an ongoing basis vaccination clinics across the city, really focusing on those areas where we historically had low percentage of kids that are vaccinated. School districts know their immunization data. You know the areas that you have where historically kids haven't been, you have more issues with kids being vaccinated. Those are going to be the target areas to make sure that those children and their families have access to vaccines.
Yeah, thank you, Eva. It's such a good reminder that schools know a lot already, right? There's a lot that you have to work with. And that idea, just reinforcing what Leah talked about as a big picture and you're looking at in the small pictures, start small, learn as you go, get that feedback, and grow from there. So thank you for that. And then last but definitely not least of our panelists, Deanna Bruce is going to share her experience with similar challenge, very different school district here in the District of Columbia.
Thanks, Carrie. Yeah, I think that's really important to keep in mind. It can feel so scary, but we actually do have those skills. I remember at the beginning, a friend of mine was like, why aren't you helping with COVID? And I was like, well, that sounds hard. And she's like, yeah, but you ran H1N1 for DC public schools. So you know how to do this. And I was like, yeah, and that was hard. I will tell you, COVID is harder than H1N1, but she was right. And then like I think she must have like whispered it into the universe, because a week later the DC Public Charter School Board called and asked me to consult with them on COVID, and here we are almost 2 years later. So I'm Deanna Bruce, she, her, hers, and I'm an independent consultant working at the intersection of, I say, health and education equity. I've worked in DC public schools for years, a decade or so, as the director of health and wellness. But since leaving, I have had the chance to work with schools across the country on a variety of school health issues, sort of emerging school health issues. And if COVID is an emerging issue, I don't know what is. So much of the past time have been working with both the Navy SEALs and the schools in DC that have taken the Deanna Bruce approach to yard work. Let's say yard work is not my core competency, so I'm going to outsource that. And if I were running a school right now, I would be hiring a vendor to run my COVID testing program. But I also love supporting the Navy SEALs who want to Army crawl their way to a weekly testing program, because it takes all kinds, and you know who you are, those of y'all who are on here. So DC has about 93,000 public school students. About half of them are in the traditional DC public schools, school district, and the other half are in our public charter schools. We've got about 67 LEAs, local education agencies. About 72% of our students are African American, 16% are Latinx, about 7% are white, 1% Asian, 42% are designated as at risk, and about 8% are English language learners. Much of last year, the schools were kind of going at it on their own, figuring it out with guidance and support from the health department and our state education agency. Yes, the District of Columbia has a state education agency. One day we will be a state, and until then we have a state education agency, and even then we will have one. And so the schools worked and kind of figured it out and looked at guidance that CDC had issued and that our health department had issued, and used their ESSER funds and pulled together a testing program. Some of our schools opened the first day, last August 2020, their doors were open and they were testing staff and students every week. And I think it's important to understand that this year, once we had our ELC money from CDC, our state education agency, the Office of State Superintendent for Education, OSSE, they gave schools a choice. We recognized that some schools probably had really built a level of trust and relationship with their school community around their testing program. And so asking them to change might not be the best situation for them. Others were like, sure, absolutely. The Deanna Bruce approach to testing, like, bring it, I'll take whatever you've got. And so we gave schools the choice. You could either sign up with us, with the Office of State Superintendent for Education, and we will run your COVID testing program. It's a saliva-based testing program. Shield T3 is the vendor that we have contracted with. They are also the vendor that tests all of the college kids in town. And so we were just expanding a relationship that already existed in the district. And then we gave schools a choice of applying for a subgrant. So they were able to take cash, or they seek reimbursement to run their own testing program. So perhaps they wanted to keep going with what they were doing. And I'm going to drop into the chat sort of what I would call the Rambo Navy SEAL type of school, the Friendship Public Charter School, which was part of this pilot that Leah described. And they started doing it on their own. And this school year, they've made some modifications and decided to use a vendor. And so it's almost like a little bit of a hybrid. Like they've done a lot of the thinking and planning and budgeting, but they brought in a vendor to do the things that they didn't want to do, like maintain the data. And also like secure the tests, and they use an antigen program. And so I think it's important to understand, like, why do we test? So that was really important to get all of our stakeholders on board with why test. And we test to stay ahead of outbreaks, sure. And then what happens when you stay ahead of outbreaks? You get to create a safe school environment. That was really important to us. And then what happens when you have a safe school environment? You have trust from your community. And last school year, getting the trust of staff was essential for them to show up to teach. This school year, it seems like it's shifted where it's been essential that we get parents and students on board and feeling safe and trusting us. And then Omicron happened, which now you've got to rebuild trust among everyone. And the social media, the misinformation on social media about not only testing, but testing in DC schools is really something that is hard to stay ahead of. And that misinformation about our own testing programs, I think it exacerbates stress that teachers are already feeling, that parents are already feeling, and that students are already feeling. And so how do you continue to build trust when you're working in an environment of misinformation? So how do we message that? Certainly information on a website, but our state education agency has bi-weekly technical assistance calls where we update on guidance and things like that. And then I'm running three, I think, communities of practice, 2 on testing and 1 on contact tracing bi-weekly for any school that wants to jump on. We usually have an agenda and then we talk through issues. And that's a way to help get our community of schools on board with us. And at the school level, what they tell me, it's frequent, it's reliable, it's predictable information coming from them to their families and to their staff. And the staff want to know before the families know about a change or something that's coming down the pike. And so that's, you use your email systems. A lot of schools have had town halls, like weekly town halls last school year. Also, I know some schools are using videos to teach people how the testing program works, and that's been really helpful. Now, a couple of things that were really important to us when we were putting this together was it was important for us that they be PCR tests. That was important for our health department. It was important for us that they be opt-out because we wanted as many people to participate as possible. And it was important that it was self-administered. We knew that staffing was going to be a challenge, so we wanted to put the power in the hands of our children as much as possible so that they could test themselves. And that's how we decided on Shield T3. It was saliva-based, so even the youngest could do it themselves. And because it was saliva-based, it was easier to get our general counsel, the general counsels on board with making it opt out. And so that's sort of where we are. And what we're doing now is looking ahead. We've got Test to Stay coming. We're now giving out antigen tests every Friday to our pre-K families and our staff. We're going to also have a mail home test where families can do that. And then looking at vaccinations, that's huge. We've got a vaccine mandate coming in March for 16 and up. And as soon as FDA sort of completely approves it for others, that will be they'll have 70 days to come into compliance. And that's gonna be really huge for us because only 21% of our 5 to 11-year-olds are vaccinated. So, it feels a little bit like Groundhog's Day with this testing program because we're still climbing uphill with a rucksack on because a lot of our kids just aren't vaccinated. So I'm going to end there and hand it over back to Carrie.
Yeah, thank you all. And again, really helpful on the ground guidance and this idea of just the creativity and the sort of problem solving that all of you have talked about. That this isn't easy, but it's also not impossible. And knowing where to start, knowing where to get help, knowing what your community needs, whether it's to build trust and communication or just more access or whatever it is all really helpful. So I want to encourage anyone who has a question, please put it in the chat or the Q&A, or if you are feeling exceptionally brave, you can even volunteer to come on camera. But we have gotten a couple of questions, and one particularly interesting one. Large bureaucracies are not known for their flexibility and nimbleness in implementing new procedures. What would be your advice on how to rapidly get new procedures instituted and embraced by the people that you're working with to get these school testing programs done?
Well, I would say that a snowball growing into an avalanche like Omicron is your opportunity. We produced antigen tests from thin air, it seems like, and threw them at all of our staff and students during winter break and had them all test before they returned. But I don't know if that would have happened if Omicron hadn't happened. So I think that there's a window and an opportunity right now because people are really freaked out about Omicron. Like, use that. That's how I always used when I was working in bureaucracy. Whenever there was a window, jump through it. And I think Omicron gives us a window.
I would say too, so there are large bureaucracies, but every community seems to have its own level of navigation through those issues, for lack of a better way to put it. And so, I think it's really important. Those of us who work in education, health is talked a lot about with education, but it's not always ingrained as part of the culture of student success. And I think if you look at our organizations that exist to support education and have their governing boards and their demographics don't typically contain somebody that relates to nursing or to healthcare for students in school. So I think that education by and large isn't set up to support physical health as much as they've worked to support the mental health of students in schools. And so I think that makes it hard for schools maybe to pivot, because a lot of the people that are making the health decisions don't feel a comfort level with making those health decisions because that's not their background. I think it's important to frame this all around the equity issue that it is, because the populations on a national level who are most at risk are those same students who are not they're academically at risk as well. So with us, that was looking at historical immunization rates, we know kids aren't having their preventive health exams is another example. They're not accessing the healthcare system. Build your case around, hey, we've got to do something at the school and district level, because these are going to be our kids that we have been so concerned about their learning loss. It's all related to each other, and we have to paint that physical health picture that has presented itself with a vengeance with Omicron, that to understand that if we're going to move kids forward to overcome this pandemic, we have to be addressing keeping them in school.
Great, thank you. I don't know, Nick, if you've got any words of wisdom from the federal government about overcoming bureaucracy, but if you've heard any particularly interesting stories about that, we'd love to hear that as well.
Well, before my current role, I oversaw school reopening in Connecticut for Governor Lamont. And I think the thing that I just saw the most was, it takes a village, right? So the way that you collaborate with your local Department of Health was really, really important. And the trust that you build, I think in those relationships with them and parents as well was huge. I think trust has just been such an issue, just because the virus has been moving so fast, and everybody wants, everybody, of course, wants psychologically the certainty of knowing exactly what we're doing and have that be comfortable with that. I think they'll be willing to do it. But when we get more information, obviously guidance has to change. And so the trust that you have already built up and the collaboration you have is really, really, really important to get everybody to keep doing things that they don't, that they're just already fatigued by. So I just think, building that connective tissue with your local departments of health, with your local parent groups, with all the community-based organizations that are involved, we found really helped move the wheels in Connecticut.
Thank you. Well, and you've all mentioned this in different ways. You've all talked about trust. Can you point to the moments? You talked about the weekly, Eva, you talked about weekly town halls. You guys have talked about different kinds of communication. Are there particular things that really stand out to you as particularly useful, or is it the combination of just consistency, reliability, being there and repeating your messages over time with everybody?
I would say using those trusted people at the school level. So school nurses as an example, families tend to trust the school nurse. And so, our school nurses help with contact tracing and making those calls to families. And so that one-to-one connection and saying, hey, these testing sites are available if you want someplace to go have testing done. That's one thing. We did a vaccination clinic last weekend. It was the second one. It was the follow-up clinic we did targeted outreach to our students who are enrolled in the English as a second language program. We've got about 12,000 students who English isn't the primary language spoken in the home. And so we targeted our zip codes with the lowest immunization rates. in the city. We made phone calls. We paid interpreters to make phone calls to those families to let them know about the vaccination clinic. We had interpreters on site to the clinic, and we vaccinated about 300 people last weekend. And most of that was because of word of mouth, talking to each other. We vaccinated 150 the first clinic. And so I feel like clinic number 2, people were a little more trusting. They were a little more, little less resistant to coming. So those personal connections are very important.
And I would say, I would add to that, that our school leaders are not public health professionals. At least most of them are not. And Eva and I might be exceptions, but so the school health team at your school district might be, but the schools aren't the experts, and so they need the words put into their mouth to share with their families. And so I really benefited from Leah's network of the 5 cities that she led, and that was a great model of how to do communities of practice. And I would say that our communities of practice that we're running in DC, and they're easy, they're quick and easy. They don't take a ton of planning. I'm always talking to schools, so I've always got a sense of what they're concerned about, but being able to come together with them, and one school will share with another, like, this is how I message it to my families. And we'll even like practice, like, this is the public health, and like antigen versus PCR. That was a huge thing over winter break. Don't take a PCR test if you've had COVID in the past 90 days, but we want everyone to take an antigen test before you return to school. Well, why am I going to take an antigen test if I had COVID in the past 90 days? Well, antigen works different than a PCR test. And then we had to actually empower our school leaders with those words of viral RNA PCR and antigen proteins attaching to the virus, or not attaching, but part of the virus. But that is those kinds of things they needed to be able to say and repeat those, because they needed to say and repeat them to their families in order to maintain trust coming back from winter break, when we know that they're going to walk into a school building where there might be a lot of COVID coming in.
And I wanted to chime in here. This is in partial response to Larry's comment in the chat. It's not surprising that the systems changes that are required for states and schools to do testing like successfully is taking time, right? Because systems change take time. You change the lunch menu in a school, it takes time for people to get used to, So, I mean, related is this idea of moving at the speed of trust. This is Dr. Giselle Corby-Smith at UNC Chapel Hill who introduced that term to me. But we're trying to balance that with the urgency and the need of the situation. And that, to me, has been the most difficult to balance in some cases. Like, so I wanted to offer that as some perspective, like this stuff just takes a lot of time in many cases.
Yeah. I do want to ask if people have any final questions. I know we have a lot of you online, and I've gotten some comments of people. I'm sensing a lot of frantic note taking. We are also going to be sending a recap email that will consolidate all of these resources and tools and guidance that everyone has shared. But I do want to open up if there are any final questions. I do think, I would say, what has surprised all of you in a good way or a bad way? Like, what has been the most surprising thing that has occurred in your work in this area over the last, hard to believe, nearly 2 years of facing this challenge in schools?
Well, I will weigh in. I would just say, it's kind of been unrelenting, I for lack of a better word. And so, it seems like every time, at least in my district and with the nursing team that we have, every time we've gotten into a good groove and rhythm, the COVID ratchets it up another notch. And so to be the ability the need to pivot and switch systems based on what the virus does next is really something, having a background in public health, that has surprised me. We're in our 3rd school year, as Nick said, and we're still, just finally having to realize this is going to be the new normal.
I would say maybe it's not so much of a surprise, but it's a validation to me of just the commitment of people who go into the profession of education. It has been unrelenting. Like, we had a break from April to June last year when a bunch of people got vaccinated. And then I think we had a break from October to the middle of November. And those have been the down times, even though we were still, working so hard. But the virus, the pandemic seems to be unrelenting, but the educators, the teachers, and the administrators continue to show up, passionate, dedicated, determined, exhausted, sometimes with their cameras off on a call because they're recovering from COVID. But they keep showing up for more, and their focus on the students doesn't seem to change. And I'm so fortunate and so honored to be able to support them through this pandemic. Grateful to know that they are the folks teaching our kids and keeping the schools safe. I'm overwhelmed with appreciation for them.
I'll say what's been surprising to me related to Deanna and Eva is how long it's taking us as a country to understand or to learn how to set our educators and school leaders up for success in this space. It is surprising and it's not, because like we think about our educators, well, they go to school to learn how to set their kids up for success every single day. And I feel like we're getting there, but we just need to keep going to really crystallize what is it that we can provide our educators, school and district leaders with what they need to set them up to successfully do this work.
Yeah. Well, and Nick, I don't know, final thoughts to bring us.
Yeah, I guess I'll close this off by saying, just echoing those points. And I've been really surprised on the positive side by how the teachers across the country have been not only able to teach well in the building and all of the responsibilities that requires, but also at the same time keeping the students so safe. I was, to be honest, shocked to look at the data at schools being some of the safest places in the community. I was a teacher and a principal myself, and it's just the amount of trust that the students must have in their teachers that they've built to be able to maintain social distancing, to be able to keep those masks on even when they're itchy and annoying, to set up an organized testing system, to do all the contact tracing on top of just great instruction is such a lion's share of work. And it's just remarkable to me how incredible our teachers are and why we need to double, triple, quadruple salaries in this country moving forward.
Well, and thank you all. I think the biggest thing I've taken away from this whole session is the incredible dimension, variety, creativity that has gone into this, and how much of it you all are wrestling with every day, and in a discussion that at a very top level often gets in, are schools open or closed? And the answer is it depends, and that it depends on all the work that people like you are doing, that the teachers are doing, that parents and students are doing. So thank you for giving this really disparate, rich perspective on all of this. I hope all of our panel, our participants found it useful. And again, we're going to send all of this, package it all up for you and send it all out in the next few days, so you have it all at your fingertips as you continue to wrestle with, I cannot believe it's only, I keep going between, I can't believe it's January 12th already, or it's only January 12th, and we've all been up to our ears in all of this for a very long time. Thank you all. Well, have a great evening. Thanks again for joining us.